So we are going to have two speakers tonight. The first one will be Dr. Hengbing Wang. I think people are familiar with him. He's a local doctor here. And so I don't want to say more, because wasting time. 那今天晚上我们有两个演讲的人，一个是王恒冰医师，另外一个是陈原霖。那这王医师，我想大家对他不陌生，他是这附近这儿的大夫，我就不多讲，就请王医师开始。恒冰 ，you want to start?
Yeah, thank you, Dharma Master. This is Hengbing again. Hello, everyone. I gave the last talk about 3 months ago, and at that time, that was just the beginning, or maybe in the mid of the Delta variant, Delta surge. And in the last 3 months, I think we have had a tremendous development of COVID-19 from all aspects. And I think now is actually a good time to give update, and hopefully next 50 minutes, I can cover as much as I can. It's going to be somewhat quick, and because we have so many subjects. 晚上好，我是那个王恒冰医生。3个月前我给了大家最后一次那个更新。那3个月之前呢，正好是这个 Delta 这个变种的这个刚开始，或者正在中间进行的时候。然后最近这3个月呢，有很多关于这个新冠的新的这种进展，包括治疗啊，还有这个疫苗啊，还有一些什么东西。希望在未来的50分钟之内，我可以尽量的那个概括，然后给大家详细的这个解释一下。Okay, next slide. Just a summary again. The world situation, we have had 234 million confirmed cases. Global death is almost 4.8 million people died from this disease. And United States, we had almost 44 million people who have had infection. And just last week, US surpassed about 700,000 people who died from this disease. And it is estimated now 1 out of 500 Americans have died from the COVID since the pandemic started about close to 2 years ago. 那第一章呢，还是介绍一下全球的形势，非常简要。全球已经有2.3亿的人感染过新冠，已经大概480万的死亡率。然后美国呢，大概已经有4400万的这个感染率。就在上星期呢，已经那个死亡人数已经超过70万。那预计呢，就是估计呢，就是每500个这个美国人里边就有1个人现在是死于这个新冠。这个数字还是很惊人的。So this is slides about the new Delta variant. I don't have so many pictures, but this is particularly important that we didn't see this before the Delta variant, but since the Delta variant surge about a couple months ago, we now see more younger people infected. You can see among the age group, age less than 55, we have had a significant surge of those age groups in comparison to other variants. We didn't have this much. So this is also kind of depicts that Delta variant has more transmission rate and also cause more serious trouble, including death. 那这张图呢，就是看了这次这个 Delta variant 这近几个月的这个爆发呢，看到很多这种年轻人呢也得到了这个这个感染率也相应产生了很大的这个非常严重，感染率变得比较严重，比起其他的这种变种来讲。这个你可以看到，去年3月和7月，还有今年的1月，那这个年轻人的这个感染率是由于这个Delta 变种变得非常的糟糕。那这个最近几个星期呢，由于这个学校的再开放，也导致了这个小孩18岁之下的这些学生的感染率也造成了很大的这种提高。 So this is just a very quick summary of new cases, deaths, new hospitalizations for the first 3 graphs. You can see that we are beyond the peak, including all 3 categories. And the last picture on the right lower corner shows the predominant strain. So we're still dealing with predominant Delta strain, Delta variant. So we don't have any other significant strain that is picking up. We were concerned about the mu strain, but that doesn't seem to be the case. A Delta strain is still a predominant strain circulating in the world. 那这张图呢，还是看一下新发生的这种感染率，还有这个死亡率，还有这个新住院率。那前3张图大家可以看到，我们这个基本上已经过了这个高峰了。这个高峰在9月初的时候到达，然后在过去的2个星期内，包括新的感染人数、死亡率还有住院率都相应下降。那最后一张图呢，就是看这个在社区流行的这个COVID 的这个具体的这个变种，那还是以这个 Delta 为主，将近99%。So this is the local Mendocino County picture snapshot. So we have total about 6,811 cases since pandemic started, and we lost 84 people. And in the last 2 weeks, we have seen some decline of new cases. And among the infection, in the last couple of months, we have had, actually since the vaccine started, we have had about 397 people who were vaccinated but still got infection. But total vaccinated people in our county is about 50,000. So if you calculate vaccine efficacy based on those 2 numbers, the vaccine efficacy is more than 99%, preventing the infection, similar to the initial Pfizer and Moderna data that prevention of infection is somewhat in the 94-95 range. And a couple weeks ago, I was in a hospital call at a peak of the infection. At one point, we had about 35 plus hospitalized COVID patients in all 3 hospitals in Mendocino County, and 90% of hospitalized patients were unvaccinated and 10% were vaccinated. So you can do the math. 那这个是我们这个门多西诺县的这个现状。那自这个新冠开始以来，已经大概有6800个人感染了新冠，6811个人，84位呢不幸这个死亡的病例。最近呢1-2周呢，这个病例有所下降，然后那个病床数呢大家也看到，现在住院的是9位，然后在 ICU 的是2位。那这个在3个星期前，我在这个新冠这次 peak Delta peak 的时候，在最高的时候，当时一共大概有35到36个病人住院，由于新冠住院。那90%呢都是这个没有打疫苗的，10%是打过疫苗的。那自是到这个疫苗开始接种以来，大概我们这个门多西诺县大概有5万人已经接种过疫苗。fully vaccinated 就是接种过全部的这个疫苗，然后在这些接种疫苗里面，大概有397位还是得了新冠，但是很少就是说有人这个由于这个住院或者是死亡。So this is kind of snapshot of the United States about our vaccine rate. So as a total, we have about 64.6% entire population have been vaccinated. And if you count only a population above or equal to 12 years old, and we're about 75%. And about 18 is about 77%. So the older people have much better a number, almost 94% of a population older than 65 years old have received vaccine. 那这个呢是大概美国的这个现在的这个接种疫苗的情况。那美国这边的疫苗主要就是这个 Moderna 和这个Pfizer 的这个mRNA 的这个疫苗。 那从整体这个人口来讲呢，大概是64.6%。那12岁以上呢75%，那18岁以上77%，那65岁以上呢将近到94%。这个数字呢还是有待提高，等一下我们还会再着重再讲述。So in this slides, I like to actually point out the deaths from the COVID. So all the deaths that we have tallied is actually a death directly attributed to the COVID-19. But there's another way to calculate a death, which is called excess death. That includes direct death caused by COVID-19 and also indirect death caused by COVID-19. For example, I'm a cancer specialist. So during this pandemic, for maybe 6 to 9 months, our cancer screening population has dropped almost 80%. So very few people actually went to their doctors to do regular checkup. Cancer is one of them. So cancer screening such as colonoscopies or mammograms have decreased sometimes more than 80% in certain area of the country. So this all are going to is going to translate somewhat increasing mortality, not directly due to the COVID, but eventually is going to be indirectly caused by COVID. So cancer is one of them, and other could be delay of seeking care for otherwise treatable disease such as heart attack and etc. So it is estimated by some researcher that the actual indirect plus direct cause of the death due to COVID can be as high as 16 million people by now since the beginning of the pandemic. 那这张图呢，我就想给大家介绍一下，就是由于新冠直接死亡的这个病例呢，大概现在是全球是480万。那其实另外一种想法呢，就是那会不会有这个由于新冠这个不是直接由于新冠死亡，但是由于新冠导致了其他一些的这种死亡的情况？比如说我是一个治疗肿瘤的医生，那在去年呢，大概大半年的时间。很多病人呢，就是说，就很多正常的这个学生不是学生，很多人呢都不去这个他的这个医生的地方去看病，包括一些肿瘤的筛查，肿瘤的这个筛查，比如说乳腺造影或者是做结肠镜。那这个呢，会到几年以后，或者是甚至1、2年之内，都可能导致这种肿瘤的这种发病。这个发现的这个时间太晚，有一个早期肿瘤变成一个晚期肿瘤，然后就会间接的导致我们就会失去更多的这种病人。那肿瘤是其中的一个病呢，其他的病还包括比如说心脏病啊，包括一些感染性疾病啊，你去医院去的晚了，那就有可能就结果就不是很好。So 那有一些这个学者呢，就把这个直接导致死亡和间接导致死亡的一块加起来呢。估算了一下，到现在，总体死亡率可能已经全球的这个包括这个直接致死或者是间接致死，大概已经有这个1600万，所以这个数字也是很惊心的。So this is probably the most striking news that we have heard, at least myself, in the last week. So on Friday, most of you may have heard that, actually Thursday, may have heard that Merck has produced a statement that their oral antiviral medication named Monopere has produced significant effect regarding reducing COVID-related hospitalizations and deaths compared to placebo. So what is Monopere? This is a very similar drug to remdesivir, which we discussed about it last year, and it was used in inpatient, but Monopere is used outpatient, taking as a pill. So, and the name actually comes from a Marvel movie, Thor's hammer is named called Mjolnir. So if you're a Marvel fan, so this will be an easy name for you to remember. It takes me a little bit. So anyway, how was this study conducted? So this study was done in unvaccinated patients. So keep in mind, this was done in unvaccinated patients with the infection, of course, confirmed by PCR, and with mild to moderate symptoms. So they are still outpatient. They're not meeting criteria to be admitted to the hospital. And those patients have to have at least one underlying conditions, such as obesity, diabetes, heart disease, or age over 60, etc. So there were planning to include somewhat more than 1,500 patients in 1:1 ratio, but after they accumulate about 700 plus patients, the data monitoring committee found out that the drug was highly effective. Therefore, they recommended to terminate the study early, so this drug can be used as soon as possible for those patient populations. So specifically, Monopere, in Monopere arm, only 7.3% of patients eventually need to be hospitalized. In a placebo arm, almost doubled, 1 out of 7 or 14.1% of patients who eventually need to be hospitalized. Regarding the death, in this 350 patients who received Monopere, there was 0 deaths. And in the placebo group, there were 8 deaths. So 8 out of 350 plus patients actually eventually died from this from COVID-19. And it's also important to know that this drug is effective against all strains of COVID-19, including Delta variant. So it's very important. This is probably biggest news and very exciting news for the COVID-19 the battle towards the COVID-19. So 那这个呢，我想向大家介绍一个重磅的药，在上个礼拜呢，这个默沙东公司也叫默克发表了这个声明。这个药呢，这个叫 Monopere， 这个名字取自这个漫威的这个里边的这个雷神的这个锤，叫Monopere。So 中文我也不知道这个药怎么翻译，我就简单翻译成雷神之锤这个药吧。这个药呢是真的是上个礼拜就是给这个我们这个治疗这个新冠的这些医务工作者呢，真是有很大信心。那怎么呢？这是一个口服药，口服抗病毒的药，跟这个以前的 Remdesivir 药那个结构呢有些类似，大概机制有些类似就是抑制这个核苷酸这个复制RNA 复制。这个药是口服药就在家里在门诊就可以发给你，然后在家里就可以吃那这个临床试验是怎么进行的呢？这个是大家看一下，这个是在未接种的人群中做的这个实验那你这个未接种的人群如果得了新冠，那你这个症状比较轻微的话，还没有进到这个需要住院的情况下，而且你有这个一些基础病，至少有一个基础病，比如说肥胖或者是糖尿病或者是心脏病或者是岁数比较大它本来是呢要招1800个病人1比1的比例，但他招了700个病人以后呢，就发现这个药非常管用，所以他这个专家组呢就临时决定在很早的在上个星期在1个月前就把这个终止了，因为这个结果太显著。那什么样的结果呢？那就是在药物组呢只有7.3%的人呢最后住院了就是症状即使吃了这个药还是最后住院了。那你这个对照组呢，这个是14.1%，将近高了1倍。那这个实验组呢，药物组呢，这个死亡率是0，就是说300多个，将近400个人里边没有人死亡。那这个对照组呢是8个病人不幸死亡。还有很高兴的一点呢，这个药呢是对所有的这个毒株都管用，也包括最近的 Delta variant。那so people now wondering if this drug is going to turn into a blockbuster to fight against COVID. So is this going to be another excuse for people who are not going to get vaccine? But my take on this is that you have to pay attention to this was only given to unvaccinated patients. Okay, so think about it. If this drug was given to vaccinated patients, they're probably not going to produce significant effect, because if you remember the previous trial we discussed about either of the mRNA vaccine, the protection of the vaccine against hospitalization is almost 95%. So it's really hard to improve upon 95%. So Merck did not even try to test this drug on the vaccinated population. So don't think about that. If you are, this will be turning to be another excuse for not getting vaccination. So vaccination is still the best to prevent getting the COVID-19. And if you do get it, the chance you are going to be hospitalized or die from the COVID is much smaller. So 那现在大家就问了，那你这个药这么好，那是不是就是这些反对或者是犹豫不决这个打疫苗的这些人呢？是不是就有更多的理由的不打这个疫苗呢？这个也是不是这样看的？我是这样看的。那你看这个默克做这个临床实验，他不是说给所有的人都做，他只是给这个没有打过疫苗的这个病人做。那为什么呢？因为这个打过疫苗的这个人本来就已经有这个得到重病的机会或者死亡的机会已经很少了。那如果默克拿这个药在这些打过疫苗的人里边做的话，那这个想要得到这样的结果，可能要招大概5、6千或者甚至更多的人来看出这个差别来。所以呢，这个也是从间接方面来证实了这个疫苗的这个作用还是很显著的。连这个药厂呢都不会在这个已经接种疫苗的这些人群里边做这种实验。So this is my own summary about the four major the tools that we have fighting COVID. So just give you four different ways. It's actually mRNA vaccine is actually not a treatment; it's a prevention. So we now have Monopere that was on the news last week. So probably going to gain approval. Or not approval, emergent authorization to use by the end of the year. Then we have Remdesivir, which is FDA approved, and also monoclonal antibody, who also gained authorized use by the FDA. So if you compare all of them, so indication, so Monopere, so it's for the outpatient, mild to moderate symptoms with now it's at least one medical comorbidities. It's oral. For taken twice a day for 5 days, and is outpatient setting. Yeah, Remdesivir is IV medication. It's used in severe disease, which translates to hospitalized patients. It's either given IV for intravenously 5 or 10 days as inpatient. Monoclonal antibody is similarly used as Monopere. It's almost used in outpatient, but you have to come to the infusion clinic to get it. It's IV for 1 time. It takes about 30 minutes, and is indicated for the same kind of patient population, outpatient with at least one medical comorbidity and also mild to moderate disease. So if you look at efficacy on the top 3, preventing hospitalization, Monopere 48% reduction versus placebo. So basically 7% versus 14%, as I discussed in the last slide. And if you look at a monoclonal antibody, it's actually better than the Monopere. It's 70% versus a placebo. If you look at preventing death, like I mentioned earlier, there was no death in the Monopere arm, but 8 deaths in the placebo arm. But I gave it more than 95% because it was only a 350 patients cohort. So more than likely it's not going to be 100%. And in Remdesivir, preventing death risk reduction is about 40% versus placebo for those severe disease and need to be hospitalized. And monoclonal antibody is as good as Monopere, but again, it's preventing the death, but it is kind of cumbersome. That has to be infused intravenously. And again, preventing hospitalization is 70% better than the Monopere. So monoclonal antibody is not as bad. However, it is more cumbersome to administer. What about mRNA? So obviously, this is a prevention method. So, and most of you know it's required 2 intramuscular injections outpatient. It's preventing hospitalizations almost 100% versus placebos. There you go. So if you get an mRNA vaccine, so it's highly unlikely you're going to need to be hospitalized, and almost highly unlikely you're going to die from the disease. Almost 100%, but if you look at numbers, we still have people who died from COVID despite a vaccination recently due to Delta variant surge, which and I'll talk to you a little bit later. So cost-wise, Monopere, it is estimated it's going to be $700 for a 5-day course, taken orally twice a day. And remdesivir, which is used inpatient, is $3,000 per 5 days use. So you can do the math. This is used intravenously in a hospital setting. Monoclonal antibody is $2,100 per shot. So it is not cheap at all. Of course, vaccine, now we get it for free, but real drug cost is about $45 for both doses. 那这个呢是我自己做的一个表，就是比较一下我们现在这个4种重要的这个工具来来对抗这个新冠的。那其实前3个呢是药，那最后一个呢是疫苗，疫苗是用来这个预防的。所以先介绍前3个。那这个雷神之锤这个新药呢，刚才讲了。是在门诊用，在家吃5天，至于就是那个轻症或者中症有一个基础病，至少有一个基础病。那你看这个住院率下降48%，那个致死率至少下降95%。它那个真正临床试验是没有人死亡。那它的这个那个价钱是700块钱，稍微先等一下，我去关一个东西，现在有一个噪音在后边。哦，现在好多了。OK， 那这个 remdesivir 呢是大概5天到10天，大概费用是至少3000块钱。那这个preventing death 呢是大概就是预防死亡呢，就是死亡率下降40%。那单克隆抗体呢也是用在这个院外的，但是需要在一个门诊里边静脉注射也是这个人群呢跟这个雷神之锤的这个 Monopere 的这个适用人群差不多，轻症至中症至少有一个这个基础病这个住院率下降70%，致死率下降几乎是100%。那大概1针是2100块钱。那最后一个呢是这个我们的这个mRNA 疫苗，那就是either是这个或者是 Moderna 或者是Pfizer 那这个大家都知道了。那个以前的这个数据呢，就是预防住院呢大概是93%， almost 是100%。那致死率呢几乎也就是这个下降将近100%。那这个费用呢当然很低了。现在我们美国这边打都是不要钱的，不管你有没有保险，不管你有没有身份，都是不要钱的。那如果真正是要掏钱的话，大概是45块钱2支。So once we talk about Monopere, I have to put this slide about Ivermectin. The deworm drug, the horse deworm drug. So there was just so much going on in the last month and a half about this drug, and I had so many patients even ask me about it. Some of them actually very well educated people try to get this from one way or another to try to take it. So there's still some other trials running on the Ivermectin, but I just list the largest clinical trial that was published in JAMA, which is a Journal of American Medical Association, early this year. So there were about 700 people who had this trial was done in Colombia. There were about 700 people who had mild COVID symptoms. So half received ivermectin, half received placebo. So the primary endpoint is resolution of the symptoms. You can see that those two lines are pretty much overlapping each other. So there was basically no difference. So in my opinion, it's pretty much close the deal. There are some very small retrospective analysis about the patient series, about 30 patients, 70 patients. I don't think those are very well-designed trial. You have to really test any drug in a randomized fashion in a large randomized clinical trial. 那我就不得不再讲一下这个一个抗寄生虫的药好像叫阿依霉素吧 ，Ivermectin。那最近1-2个月呢，有很多这个也是很多人谈起来，包括很多政客，包括我的一些病人，有些病人都是就是教育的非常都是高知分子，通过各种渠道呢吃这个药，这也不知道吃多少，没有这个很统一的标准，有的人吃的都会拉肚子，都会进了医院，也器官坏死，包括肝脏坏死。那这个呢，就是今年3月份这个美国内科学杂志不是美国医学会杂志发表的一个临床实验的结果。那这个临床实验是在哥伦比亚做的，大概700个轻症患者，在这个一半吃这个阿依霉素，这个就是这个抗寄生给这个就是一般动物吃的抗寄生虫的药，然后一半呢就是 placebo 或者是安慰剂，然后呢这个最后呢调查结果呢是看这个花多长时间能够改善症状。那你看其实这2条线基本是重合在一起，没有任何的这个结果。所以呢我觉得这基本上就可以证明了这个药基本没什么用，或者是即使有用现在我还不知道，所以建议这个大家不要这个盲目的去这个去追求这些网上一些其他这种谣言或者是不实的报道。So vaccine mandate, last couple of weeks, we have heard a lot about this. President Biden as well, and recently used the full force of the authority, presidential authority, to mandate the vaccine administration. And he proposed employer with 100 and more employees, federal workers, and also healthcare facilities that receive Medicare and Medicaid reimbursement, that pretty much all the hospitals, and individuals applying for permanent US residents. And also he suggested on the state level that it should be mandatory for many organizations, including teachers and school staff. 那这关于这个强制打疫苗的这件事情呢，现在也是被推上了这个浪尖。那前几个星期拜登总统呢也发表了演讲，他的这个建议呢就是任何一个这个公司或者实体如果有100以上的员工呢，那就需要这个打疫苗你不打的话，那就每周检测一次。不光是这些呢，还包括联邦的这种工作者或者是给联邦工作的一些这种打工的人还有是医院和诊所，如果你接收这个美国的这个政府的这个医疗的计划比如说 Medicare 或者 Medicaid， 那你这些医院和诊所呢，必须所有的这个医疗工作者都要去打疫苗还有你要申请绿卡、申请公民，你打疫苗是必须要做的这个事情这个总统还这个提出，然后这个各个州呢要尽量这个推广这个打疫苗，然后要进行这个强制疫苗，包括尤其是针对这个学校还有这个学校的老师。And in our state of California, there are many levels of organizations or the entities have mandated the vaccine, including many private companies such as Google, Microsoft, and also many hospitals, including our own hospital, Adventist Health in Ukiah, has a vaccine mandate, except a medical or religious exemption. Our hospital medical providers, including doctors and nurse practitioners and physician assistants, are entire 3 hospitals vaccination rate is over 97%. And we're talking about doctors, nurse practitioners, and physician assistants. This does not include nurses and other staff in the healthcare force. And some of you may have heard about a protest that happened in the last 2 weeks from nurses regarding the vaccine mandate. 那这个我们这个 Mendocino County 的这3个医院，基本上所有的医生，还有这些中层的医生助手叫 physician assistant 或者是护士nurse practitioner， 将近已经97%的人已经全部接种疫苗，至少接种1针，然后只有不到3%的人呢还是由于这个信仰还有这个医疗的这个免除叫 exemption。那其他的这个医疗工作者，包括护士啊，这其他的这个数据我不知道，我只知道这个医生还有这个其他中层医务工作者的这个数据。那你们也可能上礼拜或者上礼拜也看到一些消息，这块也有这个护士的小范围的这个游行，然后这个来这个有一些反面的这个呼声，来这个反对这个强制疫苗。So mask requirements in the school. So this is very obvious. So this left side is the picture. This line is the school starts for most of the schools. Dark blue is without mask requirements in school, and light blue is with mask requirements. And on the y-axis is pretty much outbreak. You can see the difference here. So there's huge difference. Basically, having requirements with mask, well, actually not without the mask requirements is associated with 3.5 more times of having a COVID-19 outbreak. 那这个呢，就是关于学校的这个戴不戴这个口罩的，那这个就很明显了。那这个是开学以后呢，这开学以前已经看着这个有一些学校开学的早，这个是大家基本上所有学校都开学。那你看这个深蓝和浅蓝这个区别还是比较明显的，那就是学校里的这个爆发。那这个大家算出来呢，大概就是你如果学校里没有这个戴口罩的这个规定的话，那你这个在学校里发生新冠这个爆发的可能性呢增加了3.5倍。So booster vaccine. So as of September 22nd, the FDA has authorized booster vaccine using Pfizer only. So we don't have Moderna or Johnson & Johnson yet, but some of the people are able to get Moderna if they have chronic medical illness. Some of the people actually I know have gotten it from the Fairground Public Health. So who are eligible from the FDA listed indications, 65 years and older. So if you fulfill any of the requirements, you are eligible. So if you are 65 years and older, if you are 18 or 65, between 18 to 64, but with high risk for severe infection. So for example, you have a chronic conditions, obesity, hypertension, diabetes, asthma, COPD, cancer, or an immunosuppressive drug, you're eligible. And this also include 18 to 64 years old with high risk exposure, so including healthcare workers, teachers, and first responders, daycare staff, grocery workers, and also those works in a shelter and prison. And it's recommended to get a third dose, booster shot dose 6 months after the second dose. And again, Moderna and Johnson & Johnson have not been approved, but it probably will be approved in the next month. 那关于这个加强针呢，第3针，美国讲的就是关于 mRNA 这第3针。那上个月9月22号，那个 FDA 呢已经发出了这个推荐，那就是你如果是65岁以上或者65岁以下，18岁到64岁，你如果有高风险，比如说你有一些基础病，比如说糖尿病、高血压、肿瘤，或者是吃一些抑制肿瘤的药这些的，抑制免疫系统的这些药，或者是你18到64岁，你是在学校工作的， 你是在医院工作的，你是在这个first responder， 就是紧急治疗人员，幼儿园，超市，或者是在那个监狱里工作的人员，你也可以打这个加强针。一般呢就是6个月，在第2针的6个月以后可以打。那个 Moderna 的这个mRNA 这个疫苗呢，还有这个 Johnson & Johnson 的 DNA 的疫苗呢，现在还没有这个被紧急使用。那估计在未来1个月应该会有明确的这个答复。大家可以稍微等一等。如果是你要想打第3针的 Moderna 或者是第2针的J&J， 应该在未来1个月就会有分晓。So why we need a booster shot? So this is the picture. This is a graph that is published. Those are actually 2 studies. So in the healthcare setting, so healthcare workers who received mRNA vaccine then experienced increasing infection with the recent Delta variant surge. You can see the vaccine effectiveness in March, April, May, June is pretty much in the 90% range. But once you hit in July, when Delta variant was in full force, the vaccine effectiveness dropped significantly into a mid-60s. And we have seen increasing people who were tested positive despite having a full theory of vaccine. Although overall, the hospitalization, severe disease, or deaths are still not common. 那为什么要打加强针呢？那这个就是一个做的一个统计，这是其实两个调查，这是医院工作者打过疫苗以后的这个感染率。那你看在不是感染率，就是这个有效率。3月、4月、5月、6月，这个有效率都是预防感染都是在90%以上。那到了7月，这个Delta 这个变种呢，导致这个疫苗的有效率呢降到了65%左右。那这个呢就产生了很大的产生了很大的一个问题，要不要打这个预防针加强针 ？So this is Israel, where they experienced an increasing surge of COVID infection, not only in unvaccinated group but also in the vaccinated group, and they started a booster shot quite early. In the very beginning of I think June or July. So they actually did a post-booster analysis, and so they analyzed the patient at risk. So this is how many 10 million who got a booster shot versus 51 million who did not get a booster shot. You can see the difference here. So people who got actually this is only 60 years and older. So those who got only 10 million people who got a booster shot, the infection risk is a number of cases of 934. And this is in a non-booster group, which is 5 times more than a booster group. They have almost 4,000. So basically 11 more times more likely to get infected compared to the booster group. And a severe illness, meaning hospitalization or death, you can see the difference here. So a 20 times difference here. So if you have a booster shot, your chance you need to be hospitalized or die from disease is 20 times less. 那这个就是以色列的这个加强针的这个结果他们打了几个月的加强针来应付这个德尔塔变种的这个趋势。那他们把这个做了一下这个详细的调查，你打了这个 booster 以后，打了这个加强针以后呢，那你这个得到这个病的这个可能性呢，没有打加强针是将近11倍的增长。那如果是关于这个住院或者是死亡呢，那就是区别就很大了，将近就是20倍的之间的区别。你打加强针和不打加强针，所以这个你如果是真的是在60岁以上。那你看了这个以色列的这个数据来讲的话，你自己可以明白这个区别在哪里，11倍和19倍，将近20倍的区别。11倍是感染率，那20倍呢就是重症。 So myocarditis, I'm just gonna go really briefly. So this is per million doses in a breakdown by age group. Younger people, 18 to 29, 26, actually, and also divided by female and male. So per million doses, female has about 4 cases of myocarditis, and a male has a bit more, 48 cases. We're talking about this per million doses, okay? So this is a very small number, but if you give 1 million doses to this population, you prevent 95,000 cases and also prevent 114 hospitalizations. So you can see the math here. So the number or the benefit is even more pronounced if you have, if you are older, so 30 and older. So the myocarditis cases is very, very rare in the older people. But if you have if you're concerned about myocarditis in your children or younger individual concerned about myocarditis, for females, you pretty much can neglect this. It's very rarely. It's 4 out of a million. So even for male, it's higher than female, but still we're talking about less than 50 cases of 1 million doses. And most of myocarditis are mild and symptoms resolve on its own without any significant intervention. 那关于这个心肌炎呢，大概就讲一下，就是这个就是一个图了，像有些更具体的报道。那每100万的这个疫苗里边呢，18岁到29岁。女的接种者呢，大概有4例的这个心肌炎，男的接种者48例，那男的比女的多一些，但是也是在这个100万的基础上，所以100万的针里边只有48个。那你如果看着100万针的这个效果呢，能够预防将近1万个这个感染，还有114例的这个住院，那这个年纪更大一点的这个心肌炎的这个发生率就更小了。然后这个住院率的这个提高呢也是更加显著。那这个你如果还在犹豫这个心肌炎的话，你看了这个结果，你应该可以这个更加明白一些，到底你的这个危险在哪里。So a little bit of politic statement here. So this is there's a huge difference here. I mean, I shouldn't say huge difference, but a clear difference here. If you live in a red state versus blue state, there's a significant difference in COVID-related deaths. So you can do the math regarding various, it's probably related to vaccine. 那这个有一点政治的含义在里边了。这个兰州和红州的这个死亡率，你也可以看到很清楚了。兰州的这个死亡率，就民主党的这个占优的这个州，新冠的死亡率和这个共和党的这个新冠的死亡率还是有很大区别的。So one last slide. Other relevant information, I'm going to go through really quick. In June, analysis showed the mRNA vaccine is safe for the pregnant woman. So, but you still should talk to your OB doctor about this before you make final decision. But the analysis showed it's safe and effective as well. On September 10th, and Pfizer vaccine provided positive data on kids aged between 5 to 11. The data suggests the vaccine was safe and effective. And to be noticed that the dose that was given to the kids in this age group is 1/3. It's about 10 micrograms for 2 doses, 3 weeks apart. September 27th, and UK study. This is also important for people saying, okay, I can just get infected, maybe get a natural immunity. You are wrong. So you can get long COVID symptoms. So if you think that you're not going to have any symptoms afterwards, at least one long-term symptoms seen in 37% of COVID-19 patients. Older people and men had more breathing difficulties and cognitive problems, whereas young people and women have more headaches, abdominal symptoms, and anxiety and depression. So any infection, this includes any infection, severe, mild, moderate infection, there is 1/3 chance that you may end up having at least one long-term symptoms. On September 30th, UK study also suggested that if you do the flu shot and COVID vaccine on the same day, it's safe. And as of last Friday, California Governor Newsom orders a COVID vaccine for eligible students in California, grade 7 to 12 mandate. This is actually the mandate. after FDA grants full approval, which is expected in the next month. 那最后一章呢，就是迅速的再浏览一下最近的一些其他发展。那6月的时候呢，这个结果表示，这个怀孕妇女如果打 RNA 疫苗呢，也是有效的，而且也证明是安全的。那这个其实你还是要跟你的这个妇产科医生要谈，最后才决定要不要打。但是这个结果证明是有效，而且是安全的。9月10号，Pfizer 这个5到11岁小孩的儿童的这个疫苗的结果发布，安全有效性跟大人的差不多。那个用的剂量呢，大概是1/3 10毫克，也是10微克，也是2针，3个星期，中间隔3个星期。9月27号呢，那个英国的这个结果显示，就是1/3的这个新冠的病人呢，会有至少会有一个这个新冠的长期的症状。那个年纪大的还有这个男的呢，一般就是有呼吸问题啊，还有这个智商脑子的这个智力的一些缺陷。那这个年轻的呢，或者是妇女呢，可能会说头疼啊，然后肚子痛，或者是有一些精神性的这些创伤。9月30号呢，英国呢说这个表明了就是打你的流感疫苗和这个新冠疫苗可以一天打，应该没有问题。这个症状呢，就是不是很严重。上周五呢，加州的州长那个 Newsom 提议所有这个加州7到12年级的学生都要强制打疫苗。FDA 如果一旦这个正式批准这个疫苗呢，就是7到12岁的就要建议全部打疫苗。So that concludes my my talk, and stay safe and thank you. 那我现在就讲完了，好，谢谢大家的这个时间。I have about 7 minutes for questions, a little over 3 minutes.
Sorry to rush you.
Oh, that's okay.
催他赶快讲完。大家有问题的话，请你那个打在聊天室或者举手。If you have questions, please type in the chat box or raise your hand. We can unmute your microphone. Min, do you want to explain that what we call the Ivermectin a bit more clear? And what was the purpose of that the medicine? Is approved for using in the animal?
Yeah, it's actually not only used in the animal for the deworming purpose. It's also actually approved in human for some deworming purpose. If you have like a tapeworm or those kind of a parasite infection, ivermectin can be used in human, and it's anti-parasite antibiotics.
Say this in Chinese.
那这个ivermectin 呢，就是中文叫阿依霉素，就是一个治疗寄生虫的病，主要是给那个动物用的，就是兽医用药。那这个人呢，也有一些适应症可以用，比如说那个蛔虫Ascaris 就可以用这个药，就是一般就是打虫药了，就我们俗称叫打虫药。那小的时候我吃过打虫药，那个你在大陆长大了，就是长得像那个宝塔一样的那个药，就是这个 ivermectin， 已经好几十年了，对。
How did it become so popular?
I don't know. So it was actually tested in the in vitro assay. So basically in the COVID-19 infected cells, and they found that this medicine can inhibit virus replication. But many things can do that in a petri dish, but it's a different game if you want to prove the efficacy in the human. 那这个药呢，就是一个打虫药，然后它就是在一些这个细胞实验里边发现，如果加入到这个被新冠病毒感染的这个真核细胞，比如说人体的一些细胞，那你如果加入这个打虫药，可以降低这个病毒的复制率。但是这个我们都知道，这个在细胞里边做的实验，在这个小器皿里做的实验，跟真正的人身体里边这个之间的关系还是很大的，所以不一定就是能够这个实现。 So far 到现在这个我们看到这个结果，在大规模的临床试验是没有用的，对。
People have any questions? 有没有人有其他的问题 ？The new medicine by Merck,
Yeah,
is for the outpatient, right?
Outpatient for unvaccinated, and with mild and moderate symptoms, and also have at least one medical comorbidities. But I think when the drug is fully approved, it will be used off-label pretty much by everyone. I'm almost guarantee it. So all the doctors will prescribe regardless whether you are you'll fit that study patient's profile or not. So, and Merck also is studying right now for post-exposure prophylaxis. So somehow, for example, if you are in a close contact with positive patients, and you can take this for prevention, almost like HIV drugs. If you have a post contact, you can take antiviral medicine for that. 那这个关于这个新药叫雷神之锤这个药Monopere 它这个估计在年底就会批。那批的这个人群呢，就是就是这个轻到中症，然后至少有一个基础病。那我可以确信的是，这个药一旦出来，大家肯定都不会这么开，应该是只要有症状可以都开了，就是管你是不是这个默克的这个人群的这个情况还有这个默克还在研究，就是你如果跟一个有过新冠病人的这个紧密接触以后的他的那个预防，就是你如果有紧密接触，但是你现在没有症状，但是你可以也吃，我估计也是吃5天吧，我觉得应该是不是很确信，来预防你这个得这个新冠。我觉得这个应该可能也是一个阳性的实验但可能需要招很多的人很多的这种病例。对。
Doc has a question for you.
Okay.
Do you think it's possible to have gathering like Buddha Rupa next summer?
Actually, this is a very good question. So I don't have time to go through this, and we're not really eradicating this COVID. There's no doubt about it. We cannot eradicate. So that's also another reason that people should get vaccinated, because you're not going to avoid this. This is not a smallpox that we're able to eradicate by very effective vaccine, or a natural infection would pretty much eliminate any subsequent infection. And this COVID virus mutates very often. So you already see the Delta variant behaving like this, and you almost guarantee to see some other variant in the future. So we're going to have those kind of up and downs. And this is going to be an endemic infection that is going to be more pronounced in areas that has lower vaccination rate. So the best way to improve our odds to not get infection is get a vaccination. So I think if we have a clear picture about vaccine and infection, if we can almost guarantee that our Buddha Root Farm participants are all vaccinated, and also have a way to do a rapid testing in the beginning and also periodically during the gathering, I think it's going to be safe. I certainly hope the Buddha Root Farm can happen next year. 那 Locke 刚才问那个问题就是那个佛根地的这个每年的这个我很喜欢，我们去了好几年了，前2年都没有再去了，今年和去年。那问明年可不可以？我觉得应该是可以的吧。大家因为现在可以看到这个病毒已经这个趋势，大家已经很明显了，这个不可能根治的。所以你如果还想着是就在家里躲着再也不出去，那不是一个长久之计啊。怎么着的你都会被感染的，因为这个而且你如果生活在一些这个这个疫苗这个感染打针率不是很高的地方，你这个风险更高，而且这个大家也看到这个 Delta 这个变种以后会有其他的变种，所以这个就已经会成为一个这个会有高峰有低谷，就跟这个流感以后是一样的了，而且它比流感的这个致死率和传播率都要高，所以想一想吧，还是打疫苗还是管用的。然后 booster 反正是你越来越时间越长，你这个有效率和安全性你也会看到，到现在这个安全性没有看到任何就是说让我担心的地方。 那如果明年我觉得这个佛根地的这个应该可以吧？如果大家都是打过疫苗，然后能在开始的时候能够有一个阴性的报告，然后中间的时候再测一次，我觉得没有问题吧？而且你想想，你打了疫苗就是得了，你也不会怎么样啊，就是。而且现在还有那个雷神之锤那个药，随便给你们吃了就，所以没有问题。
Okay, I think it's about time. Thank Dr. Wang, and we can probably more questions after Yuen-Lin's presentation. 那时间差不多，我们就是感谢王医师做这么精辟的演讲。待会儿等那个Yuen-Lin讲完以后，如果有大家有问题，还是可以问。So Yuen-Lin, are you ready?
Yes, Master.
Okay, ask Ellen to introduce you. Okay. And then you can go ahead.
Okay, Yuen-Lin Tan. He originally came from Malaysia. He graduated from the Carnegie Mellon University with the computer science bachelor degree program. And then he started to work in the Silicon Valley for many years, a very successful engineer. And then he started to practice Buddhism, and then gradually got very serious. And then he quit his job and then come to study in the master degree program in DRBU and obtained it. That was 4 years ago, right, Yuen-Lin?
6 years.
Wow, that long, 6 years ago. Yeah, he got a master degree from DRBU. And then after he graduated from DRBU, he started to volunteer in DRBU. So now his current position is the associate dean, right, of the campus life department in DRBU. So since the pandemic, so he is also a member of our CTTB Education reopening program, team member. So today he's going to share some updates of our schools reopening in CTTB. 所以陈原霖居士呢，他是从马来西亚，之前是马来西亚过来到美国读大学，在卡内基梅隆大学读书，然后拿到就是电脑工程的学士。然后之后呢，在旧金山湾区矽谷工作多年，就非常一个成功的一个工程师。然后之后开始学佛，然后之后学佛一段时间呢，他就决定把工作辞了，然后到我们的法界大学来读硕士。然后他在6年前就是拿到了法界大学的硕士之后呢，开始在法界大学当义工。他目前的职务是算是我们的法界大学学生生活组的副主任。所以在去年的新冠肺炎的疫情开始之后呢，他也是我们就是圣诚教育复学工作小组的成员。所以今天呢是由他来跟我们介绍，就是在我们万佛城内各级学校复学的情况。OK， 阿弥陀佛。
Okay, just a correction. Actually, graduated 4 years ago. Sorry.
他是4年前法界大学硕士毕业。
Okay, good evening, Dharma Masters, Dharma friends. This evening, on behalf of the CTTB Education reopening team, I'd like to give an update on the progress of the reopening of the schools at CTTB.
所以今天呢，就是很高兴诸位能够来参加这次的简报。就我来跟诸位呢简单的做个报告分享，就是在万佛城内各级学校的目前开学的目前的情况。
Let me just share my screen. Yeah, so IGDVS, which is the boys' school and girls' school at CTTB, and DRBU, Dharma Realm Buddhist University, have welcomed students and faculty staff back to CTTB. We've had classes for about 6-7 weeks now. And we have been able to do this while operating in a very safe way. So what allowed us to do that has been quite a bit of planning in the months before, and we managed to come up with a comprehensive plan that is also quite conservative in terms of safety, and which uses multiple layers of proven safety measures to protect the students, the staff of the schools, as well as the entire CTTB community. And in creating these plans, we did quite a bit of study of the COVID signs, as well as the best practices in COVID prevention, and really tried to use the best knowledge, techniques, methods that we could find to ensure everyone's safety. So the plan that we came up with actually not only meets the requirements of the US CDC, the California Department of Public Health, but in many cases, we chose to actually exceed those requirements, and I will explain more details about that later. One reason for this was in approaching the fall semester. This was the time when the Delta variant was rising in the US, starting to dominate the US. And we looked at the characteristics of that variant and the experience of other countries who had been hit earlier. And it was very clear to us that we needed to take the extra step, go the extra mile in order to ensure everyone's safety.
像在万佛城内呢，有玉良小学、培德中学跟法界大学，然后学校的复学工作小组呢，就在开学前很多个月就开始在筹划跟安排，准备如何来准备各种防疫的措施，然后也就是欢迎就是我们万佛城的所有的老师、学生能够回到万佛城上课。然后在各种的不同的防疫措施呢，我们是根据所有的有效证明的防疫措施，一种多层次的防护的一个概念呢，不只是保护学校，更重要的是万佛城所有的住众都能够保持安全。然后因为在我们的秋季班开学的时候呢，我们目前是开学的7个礼拜，在当时的时候刚好是 Delta 这个变种病毒在美国最肆虐的一个期间，所以呢，我们有参考，尤其是不止美国，还有其他国家，就是已经有就是这个变种病毒的情况，我们来考量就是如何来提高我们各种防疫措施，来可以有效的防止这个病毒的传播。所以在我们学校所做的防疫措施呢，是一种最保守、最安全的一个高标准来做，是完全超出我们美国联邦政府呢、中央疾病管理署还有加州公共卫生署的一些规定跟要求，是这样子一个思考方向来做各种准备。OK， 阿弥陀佛。
So these are in just some of the dates. You can see that the dorm students started to return in late July, early August, and then classes started at DRBU middle of August, and then the boys and girls school followed a week after that. So it's been about now is the first week of October, so it's been about 6-7 weeks since classes started.
所以玉良培德呢，他们的住校生在7月底就已经陆陆续续回到圣城，然后他们是在8月23日已经开课。法界大学呢是8月7号的住校生就已经回到圣城，16号已经开课，所以从开课到目前呢，已经有大概6到7周左右的时间了。阿弥陀佛。
So probably the most fun part of this presentation, we would like to show some pictures from the reopening. I'll start with the boys and girls school. So prepare to see some very cute pictures. You can
所以
see.
再来就是做照片的分享，因为这大概是我们今天简报最有趣的，可以看到我们所有的学生在校园内的活动的情况。阿弥陀佛。
So these are some pictures from the boys' school playground. The kids. This is
这是我们南校的游乐园，在教室旁边的游乐园。
the flag ceremony at the boys' school.
这是男校的升旗典礼。
These are the girls' school students.
这是女校在他们的教室大楼的草地外面的聚会的情况。
I thought this was a very cute picture from the girls' school.
这是我们的女校的小女生们很可爱的照片。
So one thing the schools are doing is a lot of outdoor activities. Outdoors is a lot safer in terms of COVID. So you can see here the girls meditating outdoors.
所以最主要就是把很多的一些上课的活动呢，在户外举行，像这是他们在户外的一个打坐的照片。
So this is the, I think the meals prepared by the CTTB kitchen, which CTTB kitchen has been working super hard to support all the schools and students and staff returning.
像这张照片呢，是我们的女学生到我们的斋堂去打饭之后的照片，所以我们很感恩，就是我们万佛城在斋堂服务的，不管是法师们或义工，这么努力发心来帮助我们学校能够很顺利的复学。
Okay, and also want to show some photos from DRBU's fall semester. This is the new student orientation. So we welcomed new students to DRBU from all around the world, China, Singapore, Canada, many other countries. So this is the orientation.
这是法界大学的新生训练，我们欢迎就是世界各地来的学生，有从中国、新加坡、马来西亚、美国各地的都有。阿弥陀佛。
And a lot of our activities we had to do hybrid because some people were online, some were in person. So we use technology for that.
然后他的上课方式呢，就是有网络教学，然后有一些部分的一些现场，是这样一个融合的方式来进行教学的工作。
Our new students meditating in the Chan Hall.
这是在新生训练的时候的打坐练习，在法界大学的禅堂。
This is a CTTB tour for all the new students.
这是当时新生训练的时候呢，带着认识我们万佛城校园。
So this is the photo that they can send home to their families at the mountain gate.
这是新生们呢，在我们的山门前的合照，他可以跟他们的一些家长们、朋友们分享。
These are some activities at our men's dorm, Sudana Center.
这是在善财参学中心，就是我们男学生的宿舍的活动。
And we also try and do many activities outdoors in the courtyard. And this photo is a typical classroom setup currently at DRBU.
像只要是他的课程呢，能够在户外举行呢，我们都尽量在户外教学。然后这个目前的这张照片呢，是我们的课堂的上课的情况，它就是座位的摆设跟桌子呢都保持适当距离，戴口罩。
Also, would like to show a few photos from this was what we call the CEI or Contemplative Exercise Immersion. This is the once a semester retreat which DRBU has for all the students and staff. So this year the retreat was on bowing. Bowing as heart cleansing was the theme. This was the orientation where we explained what the retreat is about, and also went over all the safety protocols.
再来这照片呢，是我们1学期1次的法德大学的共修活动，它是一种静观关照的一种沉浸式的一个共修活动。然后今年的主题呢是叫做磕头顶礼，心灵清净。然后这是在学校的户外做介绍，这是活动的主要的活动内容。
So this was the Wonderful Words Hall where we held the retreat. So you can see the bowing cushions all assigned, all spaced out. And you can see we had many air purifiers here.
这是活动主要的场地是庙宇堂，所以每个磕头的拜殿呢都是固定的座位，有学生跟我们教职员的名字，然后都保持社交距离，然后在期间呢有放很多的空气滤清器，你们可以照片都可以看得到。
So this was the 3 steps, 1 bow that we had. This is, if people probably remember, this was the front of the CTTB Buddha Hall. So we did the 3 steps, 1 bow over there.
这是其中这个活动的3步1拜的活动。大家如果看这张照片呢，在照片之后就是我们的万佛城的万佛殿，所以是在万佛殿的前面这个广场呢进行户外的3步1拜。
This was the outdoor walking meditation.
这是在户外的经行。
And this was the evening ceremony that we had in the Wonderful Words Hall.
这是晚课，一样是在庙宇堂内举行。
Okay, so those are some photos. So we've been open for about 6 weeks in person, and just some reflections. I think one thing I would say is that a combination of vaccination requirements and multi-layered proven COVID mitigations, COVID safety measures have allowed in-person education to continue safely at CTTB. We've been able to maintain a very safe campus despite the fact that the Delta surge was well underway. The Mendocino County, as well as the state of California, as well as the US as a whole, was experiencing very, very high community transmission of the Delta variant, which, as we all know, is a very infectious variant. A congregate setting. So we had people living in the dorms, we had indoor classes, people eating together, and a sizable off-campus population. So we had students and staff, both who live on campus, as well as those who live outside with their families, coming in and out for classes and activities daily. And despite all those factors, we have been able to operate now without any outbreaks and with only a very small number of cases which were effectively contained.
目前呢，已经开学有6周到将近7周左右的时间。然后根据我们这段时间的观察呢，像这种我们有要求说的老师跟学生都必须要接种疫苗，然后这种多层次的防疫措施呢，它同时的进行，同时的实施呢，可以确保就是安全，尤其是说我们有面对面在现场的教学。然后现在尤其在我们曼多西诺郡跟美国呢，目前的变种病毒 Delta 呢，尤其当时刚开学的时候呢，8月左右是激增的一个情况。所以我们当时虽然有 我们的教职员，他们是住在校外，然后跟他们家人住，每天这样进进出出的上课授课。然后有些学生呢是住校，有少数的学生是住校外。像这样子的活动呢，我们都能够确保学校的安全，所以呢，我们可以很有效的防堵就疫苗的传播。
And probably the most important reflection, which I think all of us who are involved in the schools have experienced, have observed, is just the great benefit that all the students, even the faculty and staff, everyone, and especially the students, have greatly benefited from us being able to come back in person. You probably can get a sense from the pictures earlier that there's no comparison of in-person learning, in-person interaction activities compared to online, for example, on Zoom. There's just no comparison. So everyone we have spoken with, I think there's not a single person who does not think that it has been really wonderful to bring everyone back in person.
像所有的学生呢，跟教职员，尤其是学生们，就是深切的可以感受到这种面对面现场授课的帮助是多么的巨大。因为像这样子的一个教学的结果呢，跟之前呢在网络上在线上的教学比起来呢，这种面对面的教学的结果跟成效呢是非常的有受益，尤其学生们都非常的欢喜。
So I'd just like to spend a few minutes maybe describing a bit about what our approach was and continues to be to operate this kind of in-person education while still maintaining a very high level of safety. So the overall COVID prevention strategy has three main pillars, three main aspects. The first is, I guess, what we have been calling the bubble system. So this is basically a method of keeping the school communities as separate as possible from the rest of CTTB. And the reason for this is that CTTB is still closed to the public. The CTTB population has some quite vulnerable individuals, for example, those who are not yet vaccinated or the elderly. And whereas the schools, we are operating in a much more open mode where we have people coming in and out, mingling with the outside community. So the purpose of this bubble system is to basically really minimize the risk that any kind of infection that comes in would spread and affect the CTTB population, which is still closed to the public. So that's the bubble system. In addition to that, we have fairly strict protocols whenever there is need for people from different bubbles to interact. There's some work or other contact which is unavoidable. So for those points of contact, then our approach has been, okay, let's take very careful measures to really minimize the risk in those instances. And then the third is what we call the intra-bubble protocols. So this one is within each school bubble, within each school, again, a very stringent set of safety measures to keep the people within each school safe. So those are the three broad aspects of the strategy.
学校的新冠防疫措施呢，有3个主要的施行重点。第一个呢，就是说我们用各种不同的学校的社区泡泡，最主要来隔离，就是学校的活动呢与圣城注重的各种互动的空间跟它的情况，因为这样子可以有效的去降低就是病毒从外面传到万佛城内的各种的机会，因为在我们万佛城内呢，还是有一些少数的注重呢，他并没有打疫苗，然后而且也是比较年长的注重。像这样子的一个群体呢，他们如果说受到病毒的感染呢，当然是比较一个算是高危险群。所以我们把学校的社区泡泡跟圣城的注重的社区泡泡做个很有效的隔离，这样子就可以减少 就是病毒由外传到万佛城内的各种机会。然后第二个大重点呢，就是说呢，因为学校在上课执行各种工作呢，多多少少都还是会有些跨越不同学校社区泡泡之间的这种活动。所以当我们有跨越各个不同学校的社区泡泡，或是说跟万佛城的这种社区泡泡之间的互动，像这样子呢，要如何来严格的控管各种防疫措施。然后第三个大重点呢，就是说在同一个社区泡泡之内，应该来做如何的防疫跟保护。那就指说，譬如说是我们的培德玉郎小学、培德中学跟法业大学这样的同一个社区泡泡之内的防护，是以这个3个施行重点。阿弥陀佛。
So just briefly describe what are some of the protocols for this bubble system. The general idea is we use various methods to minimize the contact and the sharing of spaces between bubbles, really to bring the potential for infection transmission between bubbles down to a very, very low level, and using various methods to do that. One of those methods is we have designated different spaces on campus for the different bubbles. So for example, the ones in orange here, these are for the boys, IGDVS boys school. The ones in blue, these are spaces designated for the girls school. In green for DRBU, and the rest are basically designated or reserved for the CTTB bubble. So this is one method that we have used.
最主要呢，我们是以各级学校的活动范围内呢来划区社区泡泡的界限。像这张图上面呢，你看到橘色的部分呢，就是我们南校的社区泡泡的界限。然后呢，在橘色的下面呢，你看到个绿色是我们法界大学的社区泡泡的界限。然后女校呢是蓝色，在蓝色的呢是女校的社区泡泡界限。然后在其他的没有圈颜色的呢，就是所谓的万佛城注重的社区泡泡。然后紫色呢，就是我们所谓就是说各个学校呢都会共同使用的空间，是这样子来划分，就是每个社区泡泡它所使用的空间，可以杜绝就是跨越社区泡泡的各种的活动。阿弥陀佛。
Alan, do you want to shall we skip this one or?
We can skip. We have 1 minute.
Okay. So as I mentioned, for any kind of essential contact between the different bubbles, we have a number of safety protocols, including everyone is familiar with the standard COVID mitigations of masking, distancing, hand hygiene, testing, and so on. But also really taking a very careful look at what are these points of contact and planning them appropriately to minimize contact and exposure.
像再来呢，就是我们在不同社区泡泡之间互动的时候的防疫措施，当然大家都很了解，就是我们的各种的要戴口罩，要加强清洁手，然后保持社交距离。那最主要呢，就是一些跨越社区泡泡的工作，必须要事先申请，然后得到核准之后呢，事先规划，所以可以把各种传染或者传播病毒的机会呢降到最低，是这样子来规划。阿弥陀佛。
And so these are the intra-bubble protocols. These are the safety measures that we are taking within DRBU, and IGDVS, the boys school, girls school, has very similar protocols. So you can see that there's not one single, one measure is not enough. The key to COVID mitigation, COVID prevention is a multi-layered approach. So we have used vaccination requirements for all eligible students and staff. We have been educating the school members of the schools of how to stay safe off campus, how to avoid risk off campus, universal masking on campus, physical distancing. A lot of work has gone into improving the ventilation and deploying HEPA air purifiers across campus. Testing, we are taking quite a rigorous approach to testing, where every member of the school bubbles is tested using a rapid antigen test twice a week, and in other situations as well. Symptoms, people staying home if they are sick, not coming to school, and containment protocols. So if we have a case, what do we do? How do we very effectively and quickly contain that from spreading to others? So just a sampling of the many protocols which are in place today.
像这是在同一个社区泡泡之间所有的各种防疫措施。那根据我们的经验呢，就是一个防疫措施是不够，所以我们必须要多管齐下，就把所有有效的方法呢，同时都能够尽全力的来执行。所以像我们有第一个要求，我们的所有的老师跟学生在法律大学呢都必须要打疫苗，那才能够再回到学校来上课。然后不管只是在校内，我们也要求我们的师生呢在校外的时候呢活动呢也要严格的遵守各种安全规范。所以当然呢，我们花很多时间，尤其在改良我们在教室内的各种通风跟空气过滤的像这样子的一种硬体设施的改变，也花很多时间的做准备。然后其中就是我们在校园内呢，每一周会有固定2次的全校的快筛的检查，所以这是所有的老师学生呢，每一周都要被检查2次，才可以继续就是来上课。然后如果任何有症状，那学生或老师呢就必须要在家里做自我隔离，那主动通知通报，然后确定就是说并不是就是有新冠肺炎的病毒的感染，那才能够再回到教室来上课。所以像这些呢都是我们必须要去做的，确实执行。所以在我们的玉良小学、培德中学呢也有相同类似的各种防疫的措施同时在进行。弥陀佛。
Okay, so this is the last slide I have. I just wanted to talk a bit about the CEI retreat, which we held. And this was the first time, I think, that since the pandemic started, that a retreat involving people from the outside coming in was held at CTTB. So we were definitely, it was a challenge. And we tried to really take a very careful look at what protocols were needed. I'll just share some highlights. It was about, we had more than 60 people in the retreat. All were fully vaccinated, and most of the practices were silent. Of course, universal masking. For group recitation, like evening ceremony, we recommended that people upgrade their mask because of the nature of that activity. It's a higher risk. Ventilation, paid a lot of attention to maximizing the ventilation, having activities outdoors, dining was outdoors. We put a lot of effort into the air purification. So you probably saw in the Wonderful Words Hall, we had about 12 to about close to 15 air purifiers distributed throughout the whole hall. And those were actually calculated to provide a sufficient number of air changes every hour. We increased the frequency of testing. So instead of testing twice a week, we tested people every other day. So Monday, Wednesday, and Friday. For people who are coming from outside the DRBU bubble, we also asked for a pre-arrival PCR test. And of course, the standard symptom protocols. The last one is really important because I think it's worth mentioning that for this project to succeed, everyone really has to do their part and in keeping each other safe. So we really encourage everyone to minimize their risk of exposure before and during the CEI. Normally that's the case, but to take it to even a step further because of the nature of the activity.
刚才有提到呢，我们有办一个共修活动，是个沉浸式的共修。然后这次活动呢，在上周举行，有60多个人参加，所以全部的人员呢，全部都有接种疫苗。然后活动呢，基本上都是全程禁语，当然所有的活动都是有戴口罩。然后在我们在做晚课呢，譬如在唱诵的时候，因为在唱诵的时候特别呼吸量会增大，会有更多的传播的几率，所以我们要求所有参加的人员呢，必须要佩戴呢过滤系数更高的口罩。然后当然所有的位置都有固定，到处我们花很多时间呢来做空气的流通。光在我们的庙宇堂内呢，就大概有15部的空气滤清器，所以我们确定呢，在每小时呢都会有几次的完全空气的过滤。 然后我们也尽量能够在户外用餐、户外活动等等。然后我们也增加了我们快筛的时间，像以前呢，平常上课呢是每一周会快筛2次，在这次的1周的活动，这4天我们有星期1、星期3跟星期5，所以我们在这1周我们有快筛有3次。那尤其是在非法界大学社区泡泡的参加人员呢，必须还要另外再做就是新冠病毒的核酸检测，确定阴性之后才能来参加活动。当然最主要的是最后一点，就是说呢，因为我们来参加的所有的人员呢，必须要能够自主负责任，所以在这个活动参加之前跟期间呢，必须要很自主的负责，然后不要去暴露在任何的新冠风险，所以大概这是最重要的一个观念。阿弥陀佛。
So in conclusion, we still have a long way to go. We are about halfway through the fall semester, and then we have the spring semester up ahead. But I think so far it's been very encouraging. It seems that with vaccination requirements, highly vaccinated community, with a multi-layered mitigation plan, multi-layered safety measures, and really a community that understands what is at stake and is really cooperating in a very, I guess, in a very kind of community-minded way to keep each other safe. It is possible to bring people back in person and resume activities even amidst the Delta surge. So I think one thing is that we definitely want to be very humble and respectful of the of coronavirus, and but so far so good. So far it's been very encouraging. So I just want to end by expressing really our deep gratitude for it's taken a lot of hard work by many people to reopen the schools at CTTB. And I just want to express our deep gratitude to everyone who has helped make this a possibility. 阿弥陀佛。
再来呢，我们要感谢全体防疫团队的努力，然后还有万佛城的支持。因为最主要呢，我们的秋季班呢现在过了一半，然后春季班呢也在春季明年会开始，所以目前的防疫措施的结果呢，当然情况是非常的令人鼓舞。然后最主要呢，就是我们有要求全部的人员都必须要能够打疫苗，所以这种高疫苗的这种实行呢，真的能够确保病毒的就是感染跟传播，然后把所有的防疫措施呢，能够同时的多管齐下来进行。然后最主要呢，所有的人员呢，必须也要能够负起这个责任，每个人呢都必须要了解到保护自己、保护社区这样一个最主要的一个概念。所以我们当然是非常的谦卑，目前来讲呢，我们的效果都很好，所以我们是充满感恩大家的努力跟我们万佛城的支持，所以我们学校呢可以很顺利的在万佛城内复学。谢谢大家，阿弥陀佛。
Okay, I think we thank Yuen-Lin's presentation. Also, Alan's translation. 那么很感谢Yuen-Lin的讲演和 Alan 的翻译。I must say that this whole thing actually was primarily designed by Yuen-Lin. He spent a lot of time. You can call his the mastermind. 那这个必须讲，就是说学校能够复学这个整个设计啦。这个主要是Yuen-Lin他花了很多时间去研究，然后设计出来的，所以它是最大的工程。We are running very late, so I'm afraid that we don't have time for questions. 我们时间已经很晚了，所以没有时间让大家问问题。But I think, like you from school model, that it's possible to have Buddha Roof Farm retreat next year. 像那个Luck原来问到就是说，明年有没有可能在佛根地在办活动？想从学校这个做法的话，应该是没有问题。 And next, I'd like to talk about the coming forum program. And it's Dr. Ye online. He's supposed to talk about this. And so starting from next Sunday, we are going to have a forum. This is a 6 weeks forum, every Sunday evening, same time. 那从下礼拜天开始，叶教授他组织这个研讨会，这讨论生命的意义。总共有6个星期天，从下礼拜天开始。So the forum is on the quest for the meaning of life, and it's starting next Sunday. Next Sunday will be Reverend Quinshur and Nippon. These are, every time is 2 person. I think it's more like a dialogue. 那这个下礼拜天就是施法师Nippon 他2个人在讨论对谈。那每一周都是这样很对谈的方式。And this will also be streamed on YouTube. We don't have the link for everyone yet. We'll provide it later. 那这个会还是会有直播到 YouTube 上的，我们现在还没有那个连接，所以再给大家。那 the Zoom link is the same as Sunday, like today's, will be exactly the same. 那 Zoom 的连接和我们往常星期天的是一样的。And the forum will be conducted in English only, so it's going to be a simultaneous translation to Mandarin. 那这个研讨会呢都是英文发音，所以听华语的就会同步的翻译。我想大家这个也有讲，告诉你怎么样去进入那个中文的地方，就可以听到翻译。大家很熟悉的。So this is just the explanation how you enter the Chinese room. And for English speaker, you don't need to worry about this. Okay, so much for that. I think we'll dedicate merit. And then can you lead us to dedicate merit?
Okay, 阿弥陀佛。May the merit from this practice adorn all the Buddha's lands, repay the kindness from above, and rescue those in paths below. May all who see or hear all this result upon awakening, and when this body meets its end, be born together in the land of bliss.
We pause. In respect to the Venerable Master, thanks everyone.